Hello, today we'll discuss Mycoplasma infection, and this infection can cause pneumonia. Mycoplasma and other atypical bacteria usually cause pneumonia in 1 out of 5 patients. So 4 out of 5 patients are caused by other bacteria, and the most common one is Streptococcus pneumonia. But Mycoplasma is also important because 1 out of 5 is very high number. So we need to discuss how we can diagnose Mycoplasma, because the diagnosis of Mycoplasma is a little bit different from bacterial pneumonias. So Mycoplasma, this is how you write it, Mycoplasma. And this is a rod bacteria with no cell wall, which means that you cannot detect it by gram stain. Gram stain is usually used to detect other bacteria causing pneumonia, but this cannot be used because there's no cell wall. So no cell wall. And why is this important? Because we cannot use gram stain, which means that we need to use some more specific tests. And the most important test to detect Mycoplasma is something called PCR, polymerase chain reaction. How do you write it? You write it like this: polymerase chain reaction. And this is the most important test that you can do, the most sensitive, the most specific, the most rapid test. It does not take so long time if you compare it to, for example, culture. Bacteria are usually cultured on plates of media, on agar, and it usually takes more than 2 weeks. And this does not take 2 weeks. It's very quick, because we check the DNA of the bacteria here, Mycoplasma, and then you get the results, and very sensitive. Culture takes more than 2 weeks, and we cannot let the patient be untreated. We need to treat the patient quickly, so we cannot let the patient wait for 2 weeks. That's the main message here. Polymerase chain reaction, so PCR is the one you need to do. And there exists another test that is called serology. Serology just means sero comes from the word serum. So you take a blood sample of the patient, and then we check it with something called enzyme immunoassay. Immunoassay, abbreviated as EIA. So you have PCR, which is this first test of choice. The second test of choice is EIA, so enzyme immunoassay, taken from a blood sample. This is the second best option. If you don't have money to perform a PCR, because PCR is a little bit more expensive. This is also very sensitive, and but it takes also around 2 weeks. So you need to take a sample here, the first sample you take here, and then you wait around 2 weeks to take another sample of blood. And if you see a more than 4 times increase in the antibody level, then you know it's an infection of, for example, Mycoplasma pneumonia. So you need to check the difference between the first sample and the second sample, and it takes usually 2 weeks to perform, 2 weeks. And if you see an increase in the second sample of more than 4 times of this antibody level that you saw in the first sample, if you see an increase of 4 times, then you know it's Mycoplasma pneumonia. So this is very good, but it also takes time. So it means when you take culture, that we said, when you in this agar plate, or when you take this enzyme immunoassay, you need to start a broad spectrum antibiotic immediately after you have been taking this. So you take the sample, and then you start the antibiotic treatment, and then you wait 2 weeks, and then you see if it's a Mycoplasma pneumonia. And if you get the results that it is, then please start the treatment against only Mycoplasma pneumonia. So don't treat bacterial pneumonia when you only have Mycoplasma pneumonia. So when you have a Mycoplasma in the results, you need to attack this one. And the way the reason why I'm emphasizing this is because we said that this is a rod with no cell wall. If you don't have any cell wall, then for example antibiotics like beta-lactam does not work, because beta-lactam will attack the cell wall. So if you have no cell wall, then it's useless. Mycoplasma does not have any cell wall, so you cannot use beta-lactam, because usually in broad spectrum antibiotics you will give a beta-lactam with some macrolides. And why? Because the beta-lactam will attack the Streptococcus pneumonia, which is the most common type of bacteria causing pneumonia, but the macrolides like azithromycin, so this is a group of medication, macrolides, and then you have the specific name of the medication is azithromycin. That's the best macrolide against Mycoplasma pneumonia, and you will give it like this, 500 milligram in the first day, and then you will give 250 milligram from day 2 to day 5. And the golden number is number 5, which means that you will treat this patient for 5 days with a macrolide. Azithromycin, 500 milligram the first day, and then 250 milligram the second, third, fourth, and fifth day. So macrolides will attack Mycoplasma. So what I meant is, when you take the blood sample from the patient and you check this enzyme immunoassay, you wait 2 weeks. Which means meanwhile you give a broad spectrum antibiotic, beta-lactam and macrolide, and then in 2 weeks you will get the result that this is a Mycoplasma. Then you stop beta-lactam, you don't need that more, because we know that it's a Mycoplasma, so we only need to give azithromycin, macrolides, if the patient is not well, because in two weeks time the patient is usually treated. So a broad spectrum, which means empiric with beta-lactam and macrolides, is usually in 98% of cases is usually effective. Only 2% of cases is not. So it means if you give an empiric antibiotic treatment, it should work. And in 2%, let's say we have now waited 2 weeks for the results, and the patient is still sick and still has pneumonia in 2% of cases, then we stop the beta-lactam, we don't need these, and we go on to treat Mycoplasma more aggressively. And this is with macrolides, as we said, azithromycin. If the macrolide resistance is very high in your country, for example in the United States, we have around 40% macrolide resistance against Streptococcus pneumonia, for example. If the macrolide resistance is very high, then you give something called doxycycline. 2 times 100 milligram. 2 times 100 milligram. So once in the morning and once in the evening. Or if you have a resistance against doxycycline, then the last step that you can do is fluoroquinolone. Fluoroquinolone. And this is, for example, levofloxacin. Levofloxacin, which is 750 milligram once per day. So fluoroquinolone is the group of medication. The best one is levofloxacin, 750 milligram per day. But always start with macrolides. If the macrolide resistance is too high, then go on with doxycycline. If the doxycycline resistance is too high, then go on with fluoroquinolone, like levofloxacin, 750 milligram per day. Doxycycline is 2 times 100 milligram per day. Macrolides like azithromycin is 500 milligram first day, and then 250 milligram the second to fifth day. Good. What about the symptoms? How do we know that it's Mycoplasma? Why didn't I mention the symptoms in the beginning? Because symptoms, forget this. Chest X-ray. Chest X-ray is the gold standard, is the best diagnostic tool for pneumonia, but the radiologist who checks this X-ray can only tell you if it's a pneumonia or not. He cannot really tell you if it's a Mycoplasma caused pneumonia or if it's another type of pneumonia. Like there is Legionella, there is viruses, there is bacteria, there is all kinds of causes of pneumonia, and the radiologist can only tell you if it's a pneumonia and not if it's Mycoplasma or not. So the best test, as we said, is PCR, which is polymerase chain reaction. That's the only way you can tell it's Mycoplasma, and that's quick. The next step, as we said, was serology with enzyme immunoassay. That takes 2 weeks. The third step was culture. Third type, that was culture. That takes also 3 weeks. And it's not really good in this case. It's not so sensitive. So PSR is the most important. PSR. So forget chest X-ray symptoms. Of course you need to check the chest X-ray only to know that it's a pneumonia, but forget it if you want to know it's a Mycoplasma. That's what I mean. PCR is the most important. And symptoms. Which type of symptoms do we have? Many patients does not have any symptom at all, because Mycoplasma disease is very gradual, so it takes some time for it to develop. And once it's developed, not every case will have a symptom at all. And if you get a symptom at all, then it will be very general symptoms like headache, chills. You will have a low-grade fever. These are very general stuff. A runny nose. If you look into the pharynx region, you will have a redness or pharyngitis, so it's an inflammation of your pharynx. So as you see, these are not specific enough. So symptoms can be related to the respiratory system, cough, non-productive cough. So atypical bacteria like Mycoplasma are called non-productive. Non-productive means that it's not produced by bacteria. It's not producing any thick mucopurulent sputum. It's more water-like. It's more dry. So if you cough up, it's so dry, nothing comes up. It's non-productive. So cough. We said fever, low-grade fever. Chills. Very, very general. Headache. These are respiratory type. And if you auscultate, if you use a stethoscope and you auscultate the lungs, it's very, you will not hear anything really. Late in the disease, you can maybe hear some scattered rails or some wheezing sound, but physical examination is not really giving you any information. And these are also very general. These symptoms can be caused by many other diseases. You cannot tell that this is a Mycoplasma only by checking cough, fever, chills, or headache. This is too general. So PCR, please. That's the most important. And then there's another group of symptoms that are very interesting to know, at least. These are extra pulmonary. And why do I say extra? It means outside of the respiratory system. Respiratory or pulmonary is the same thing. Pulmonary is lung, respiratory is lung, for example. And extra are, for example, outside of the lung. So there are symptoms outside of the lung, and hemolysis is very common. Hemolysis means that you have a red blood cells here in your body, and that gets destroyed. Let's say it opens up here and all the contents go out. And that means it gets destroyed, so you get a reduced number of red blood cells in your blood, in your vascular system. And this is what we can see in the laboratory. So you will get an anemia. So the lab will show an anemia. Anemia means reduced number of red blood cells. And what will happen then? It's a hemolytic anemia, because we have many types of anemia. In this case, the anemia was caused by hemolysis, so destruction of red blood cells. And we will see in the lab also increased amounts of Reticulocytes. Reticulocytes. These are cells that produce red blood cells. So the body got a hemolysis, which means the red blood cell got destroyed by this Mycoplasma infection. That the body gets then into action and starts to produce more red blood cells. And the precursors to the red blood cells are reticulocytes. So that's the step. The body produces reticulocytes, then reticulocytes produce red blood cells. But this takes a little bit of time. So you have an increased number of these in the lab. And also something called positive Coombs test can be seen. This will be dealt in another video, where you can check it up in the internet. So the important thing to remember is extrapulmonary symptoms means that you have symptoms outside of the lungs, meaning here hemolysis is in the vascular system, where you had a destruction of red blood cells that caused an anemia. Anemia then the body then produced a lot of reticulocytes to compensate for this. And this is what we can see in the lab. They will check the lab and they will say, what? Hemolysis? Let's say there's a patient with no symptoms, and then the patient has a lab value of hemolysis or anemia. Then the doctor thinks that this is only anemia. We need to treat the anemia with some medications or so on. And he don't think of Mycoplasma. Okay, 60% of patients with Mycoplasma infection can get the hemolysis, so anemia. So it's very, 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 very common. Other extrapulmonary are, for example, central nervous system infection. Central nervous system, so your nervous system. The brain can get an inflammation, that's called encephalitis. This is one of the most common central nervous system symptoms. Encephalitis, encephalo means brain, so brain inflammation. Itis is inflammation. What else? We have heart diseases like conduction disease or rhythm disease or congestive heart disease, chest pain. All of these symptoms can also be seen. What else? Liver disease can be seen. An inflammation of the liver. Hepatitis. Hepat means liver. Itis, inflammation. Hepatitis. So we have hemolysis, central nervous system, heart, hepatitis, liver disease. These are, for example, the most common. And then we have also joint problems can be seen. So I will write here joint. Polyarthritis. Not arthritis. Polyarthralgias. I will write it here. Poly stands for many joints. Polyarth. This is joint. Algias. So here we have pain. Arth is joint and poly is many. Many joint pain. So pain in many joints. Polyarthralgias or myalgias. Myalgias. Muscle. Algias, pain. Pain in muscle. Pain in many joints. This is in joint. Liver, we said inflammation of the liver, hepatitis. Heart, conduction, rhythm, congestive heart failure. Central nervous system, inflammation of the brain, encephalitis. Brain-itis, inflammation, brain inflammation. Hemolysis. In 60% of patients with Mycoplasma will get a destroyed red blood cells, which means we can see that in the lab. So whenever you have these type of symptoms, then you need to treat the patient really quickly, because, for example, central nervous system infection is very, very, very dangerous. You cannot really joke about this. So if you see any type of nervous system changes in relation to Mycoplasma, then please treat this quickly with these macrolides that we said. Or if you see any type of hemolysis, then you need to treat this. Okay, so for example, central nervous system hemolysis, glucocorticoids. Please give glucocorticoids. Corticoids together with the macrolide. So glucocorticoids will then treat this inflammation. It will reduce the inflammation of encephalitis or hemolysis. Because this is an immunologic reaction. For example, the immune system is attacking the red blood cells, and therefore the red blood cells get destroyed. So this mycoplasma infection caused that the inflammatory the immune system attacked the red blood cells, and therefore with glucocorticoids you can decrease this inflammatory response. The same goes with encephalitis. Here is an inflammation. Inflammation means the immune system attacks itself, one can say, and then the glucocorticoids decrease this inflammation. So that's what you have to remember. So to conclude now, I will write some keywords so you can have this as the main message, take-home message. So Mycoplasma, the best method to detect it with is PCR, so polymerase chain reaction. The treatment is with azithromycin. Azithromycin, 500 milligram first day, and then 250 milligram the second to fifth day. When you treat, if you have a high resistance in the community or in your country of macrolide, this is a macrolide, then you give doxycycline, which is 100 milligram two times per day, and or fluoroquinolones like levofloxacin, 750 milligram once per day. And these two have to be treated for 1 to 2 weeks or 7 to 14 days, whatever you like best. 7 to 14 days you have to treat this Mycoplasma infection when you treat it with doxycycline and levofloxacin. With azithromycin, the key number is 5 days, not 7 to, because azithromycin is a macrolide and that is best against Mycoplasma. And I would say that this is the main message I want you to take home. So if you have any questions about Mycoplasma related to pneumonia, the best test is PCR, and then please start to treat it with a broad spectrum antibiotic. Or when you get the PCR results, which is very quick, then you forget beta-lactams and you go on with azithromycin 500 milligrams and then so on. So thank you very much for listening.